This week, we've heard a lot about the rising number of COVID cases. People who are unvaccinated are getting a lot of the blame from health experts who say they are the ones making up a large percentage of hospitalizations. Health reporter Haley Hernandez spoke with one mom today about why the added pressure is not working to persuade the unvaccinated. Haley?
That's right. So we are approaching 5,000 deaths in Harris County and the city of Houston. We know that cases are rising, and health experts say the only way for people to get out of this pandemic is to get vaccinated. But the decision to get a vaccine should be a personal choice, according to one organization who wants you to know that the choice goes beyond Republican and Democrat wars.
DeAndre Hopkins inserted himself into the debate on whether to get vaccinated with this tweet that says, being put in a position to hurt my team because I don't want to partake in the vaccine is making me question my future in the NFL. He deleted that. Perhaps he felt the heat of losing $22 million if he did leave the NFL, or like many others, he may feel pressure by friends, family, employers to get a vaccine. Right here, for example, Dr. Peter Hotez with Baylor College of Medicine says if you don't get one and end up in the hospital, it's your fault.
So first it was defiance of masks and social distancing. Now it's defiance of vaccines. And so this anti-science movement is a killer.
Jackie Schlegel with Texans for Vaccine Choice, an organization that started in 2015 to advocate against vaccine requirements, flips the script on Hotez and says,
I could never imagine treating anybody with such a lack of compassion. Truly, if a family gets a vaccine and their child's injured by that vaccine, I could never in a million years contemplate saying to them, well, that's what happens. Vaccines have side effects.
But with 40% of our area is unvaccinated, and while some may wear that as a badge of honor, Schlegel says for most, it's about the right to choose.
They want to go into their doctor's office. They want to have open, honest, candid discussions about if this vaccine is right for them. If it is right for them, which is the best product on the market.
Now, some of you have also asked me when the FDA will fully approve the vaccine, as that may play a role in your decision. Now, President Biden says it will happen quickly, but historically, it never happens quickly. We know Pfizer was the first to apply for full approval, which happened in early May. So some of my contacts say it might be early next year before there's full approval. Typically, emergency use authorizations happen quickly during a public health crisis, but the FDA plans to take their time nitpicking all the data before giving this one full approval. Chris?
Thank you, Haley.